Today, I will talk about key performance indicators which are useful in hospital management. This lecture is part of my series of lectures on hospital management. This is my chapter outline. First of all, I will give introduction. Then I will talk about domains or various dimensions of key performance indicators. Then I will talk about key performance indicators under following headings: equity and access indicators, operational indicators, efficiency indicators, safety indicators, patient experience indicators, financial indicators, human resource indicators, social accountability and reaction indicators, document compliance indicators. Knowledge, evaluation, and transparency of one's own daily process is key to improve quality of therapy. So we should have knowledge of our daily process. We should evaluate our daily process and we should keep transparency in our daily process. Key performance indicators are surrogate markers that indirectly but numerically map quality. Quality indicators in healthcare can be divided into structural indicators, process indicators, and outcome indicators. Outcome indicators depend on structural indicators and process indicators, as well as various other influences. Indicators should be relevant to the problem, should be understandable, should be measurable, should be behaviorable, or an action can be taken on the indicators and should be achievable and feasible. Key performance indicators may have a limited lifespan and must be re-evaluated with respect to their efficiency and validity after a period of its use. For example, if a key performance indicator is 100% for past few periods, then it may not be useful further because we have achieved 100%. Functions of key performance indicators include evaluation, monitoring, and alarm function. This is key performance indicators cycle. There is a baseline value. Then we keep on recording and analyzing the key performance indicators value. We take action on the basis of key performance indicators value. Then we review to show how the key performance indicators are affecting our decisions. As we have seen that key performance indicators have a life cycle. So this is the KPI cycle. Then about domains or dimensions of key performance indicators for hospital management. There are three core principles of hospital quality. One is safety, effectiveness, and patient-centeredness. So these are basically key dimensions. One is the safety of patients, of family members, of staff. Other is effectiveness of the hospital processes. And third is the patient-centeredness indicators or indicators describing patient experience. Health performance, the levels are strategic, tactical, and operational. This I have taken from this article. The performance dimensions, as we have seen as domains or dimensions, include safety, effectiveness, efficiency, timeliness, patient-centeredness, and equity. System components, as we have seen, structural indicators, process indicators, and outcome indicators. So let us see what I will describe in my lecture, how I have classified the hospital indicators. I have classified them into following headings: equity and access indicators, operational indicators, efficiency indicators, safety indicators, patient experience indicators, financial indicators, human resource indicators, social accountability and reaction indicators, and document compliance indicators. So, description of these dimensions: clinical efficiency, technical quality, evidence based practice and organization, health improvement and outcomes, both individual and related to patients. Production efficiency or efficiency indicators. These include resources, financial components, that is, financial systems, continuity, additional resources, more high proficiency personnel, and provision of state of art medical equipment and technique. This I have taken from this article. Then HR indicators. These include satisfying the human resource needs, creating motivational system in order to stop migration of specialized human resource, providing proper conditions to keep the health of hospital personnel safe, and also improve it and ensure fair opportunities for continuous medical education. So this is about HR indicators. Then focus on patient or patient-centeredness or patient experience, availability towards patient, that is focusing on the client, that is prompt attention, access to social aid, politeness, selection of service suppliers, patient satisfaction, patient experience, that is dignity, confidentiality, autonomy, communication. Social accountability and reactivity, that is orientation towards community, response to needs and requirements of community, access to resources, continuity, health promotion, equity, abilities to adapt to increasing demands of the population. So these are the description of various dimensions. Then now let us see various indicators. So first heading is equity and access indicators. Under this, I will describe indicators for patient access, for wait time, for emergency department or emergency room wait time, specialist care wait length, elective surgery wait length, preventable hospitalization for chronic diseases. Patient access indicators include number of patients referred, number of patients accepted, percentage of patients accepted, number of patients on waiting list for admission. Wait time include patients' wait time for admission, for discharge, for triage, for ambulance, and for diagnosis, including both laboratory and radiology. Emergency room wait length include timeliness in emergency room, percentage of patients who attend emergency room and who depart within 4 hours of arrival. Patients admitted, discharged, or transferred from emergency room within 6 hours. Patients admitted from emergency room within 8 hours. So these are the key time slots. One is 4 hours, 6 hours, 8 hours. Average time patient who came to emergency room with broken bones had to wait before receiving pain medication. Percentage of patients who left the emergency room before being seen, percentage of patients who come to the emergency department with stroke symptoms who received brain scan results within 45 minutes of arrival. Specialist care wait length include percentage of specialist outpatient waiting more than the clinically recommended time frame for their urgency category. These are the recommendations. Patients who said that the time they waited was appropriate, and 18 weeks maximum wait from referral to treatment for planned procedures. So this is the key time interval 18 weeks. Other scheduled surgery wait times, including hip fracture, which were performed within 48 hours. Then other procedures include hip replacement wait time, knee replacement wait time, 12-month maximum wait for IVF for eligible patients, cataract surgery wait time. Then proportion of acute stroke patients admitted to acute stroke unit within 4 hours of arrival at hospital, interval in patients with stroke to surgery, outpatients with chest pain or possible heart attack who got aspirin within 24 hours of arrival, outpatient with chest pain or possible heart attack who got drugs to break up clot within 30 minutes of arrival, average number of minutes before outpatient with chest pain or possible heart attack who need specialized care were transferred to other hospital, heart attack patients given PCI within 90 minutes of arrival, coronary artery bypass graft wait time for urgent category, semi-urgent category, and scheduled category. Then elective surgery wait length, median waiting time for elective surgical procedures. Now, other than wait length, other surgical indicators include elective surgical procedures performed on time, number of procedures performed, cancelled operations, percentage of repeat surgeries, wrong site surgery, leaving a foreign object during surgery. Then hospital admissions for chronic diseases, disparities in effectiveness, that is, avoiding hospitalizations for chronic conditions. For example, people with 3 or more emergency room visit or hospitalizations in a year for selected chronic and vaccine preventable conditions. Then operational indicators. Operational indicators I'll talk under following headings: asset utilization indicators, inpatient utilization indicators, outpatient utilization indicators, operation room utilization indicators, emergency room utilization indicators. So first, asset utilization indicators. So bed utilization include average length of stay, bed turnover interval, bed occupancy, bed turnover. So these are the indicators of bed utilization. Indicators of equipment utilization, that is utilization time, maintenance time, idle time. Then other asset indicators include total lab investigations, total radiological procedures, total prescriptions. Then inpatient utilization indicators, number of beds, number of admissions, number of discharge, average daily census, total inpatient days, average length of stay, average bed occupancy rate, bed turnover rate, number of patients with more than 30 days, more than 60 days, more than 90 days, that is length of stay, number of ICU beds, number of ICU bed occupancy rate, average ICU length of stay, number of patients transferred to home health care, number of deaths, mortality rate, doctor on call at night. Then outpatient utilization indicators, total number of outpatient clinic visits, average first available slot more than 30 days for new patient seen, follow-up patient seen, new follow-up seen, number of no-show patients, percentage of no-show patients. Then operations room utilization indicators or operation theater utilization indicators, number of operation room cases booked, number of cases performed, number of cases cancelled, percentage of cancellation rate, number of operation room cases done in a day, procedure unit and endoscopy, percentage of operation room cases done in DPU and endoscopy, operation room utilization rate. Number of cardiac surgeries, number of renal transplant, number of bone marrow transplant cases for adults and pediatrics. Then emergency room utilization indicators, total number of emergency room visits, emergency room waiting time, door to doctor, emergency room treatment time, doctor to disposition, emergency room admission time, that is boarding time, percentage of patients left without being seen, mean length of stay in emergency department. Then efficacy indicators, I will talk about under following headings: unscheduled care, hospital efficacy in admission and discharge, cancer-related indicators, length of stay, and clinical efficiency. Unscheduled care include emergency department and local injury unit. The KPI, as we have already seen, include waiting time for care, number of patients on trolley who are waiting, unscheduled care attendance, percentage admitted or discharged within 6 hours. We have seen the key time interval as 4 hours, 6 hours, 8 hours. Incomplete treatment, it should be less than 6.5%, 6 hours and 9 hours unscheduled wait time. Then challenges include large hospitals may have high burden of complex patients, so we cannot compare these KPI among hospitals. Then hospital efficiency in admission and discharge, that is acute medical discharges, acute medical 30-day readmission rate, percentage of elective surgical inpatient admitted on day of procedure, delayed transfer of care from hospital. Then cancer-related indicators include the proportion of patients having radical surgery for lung cancer. These are efficacy indicators of hospital. Proportion of patients with consistency between clinical and pathological staging. Lung cancer patients survival post-surgery, that is 30 days, 1 year, 2 year, 5 year. Unplanned re-intervention after a resection of primary colorectal cancer. Complications from surgical treatment of esophageal and gastric cancer. Percentage of patients in whom cancer tissue is remaining after initial breast conservative surgery. 5 year relative survival rates are used with cervical cancer patients, breast cancer patients, and colorectal cancer patients. Breast cancer deaths in female and colorectal cancer deaths are measures per lakh population. So these are cancer-related efficacy indicators for hospital. Then length of stay is another efficacy indicators. The average mean length of stay for a given diagnosis for patient to stay 1 or more nights in hospital. Average length of stay per birth or relative stay index. This is for neonates. Then admission stats and discharge statistics. Then clinical efficiency include rate of rehospitalization, rate of mortality, rate of complications, average length of hospital stay, average cost, rate of utilization of existing technology, rate of bed occupancy. Then safety indicators, I will discuss under following headings. First, I will talk about incidents in hospital mortality rates, unplanned hospital readmissions, or hospital associated infection, post-operative thromboembolism, harm, safety of maternity services, false related indicators, pressure ulcers, and other safety indicators. So first of all, hospital incidents, number of patients acquiring infections or hospital acquired infections. This I will talk about in detail a little later. Then transfusion reactions, wrong in the type of blood group, bed source, I will talk about little later. Post-operative respiratory failure, pulmonary embolism or deep vein thrombosis, post-operative sepsis, post-operative hip fracture, post-operative hemorrhage or hematoma. Then rate of complications, percentage of occupational accidents, needle stick and sharp injuries, and sentinel events. So these are various incidents with respect to safety. Then in hospital mortality rates for certain conditions like ischemic stroke or myocardial infarction, fractured neck or femur, pneumonia. Hospital standardized mortality ratio. This is very important KPI, especially in intensive or critical care units. Then hospital 30-day mortality, deaths in low mortality diagnosis related groups. So for deaths like for conditions like headache, hand procedures, and arthroscopy, these are important key performance indicators. Then deaths from venous thromboembolic events, infant mortality deaths per 100 or per 1,000 live births, post-operative death rate, and post-procedural death rate. So these are various indicators of mortality in hospital management. Then unplanned hospital readmissions include 30-day readmission, emergency readmission within 30 days of discharge, unplanned hospital readmission rate for patients discharged for following conditions after treatment: acute myocardial infarction, heart failure, knee replacement, schizophrenia, pediatric tonsillectomy, and depression. Then hospital-associated infection include following indicators: sepsis following abdominal surgery, incidence of healthcare-associated Staphylococcus aureus bacteremia, including MRSA, incidence of healthcare-associated Clostridium difficile infection, the percentage of patients with a hospital-acquired infection, discharges with central venous catheter placement with associated bloodstream infection, then wound infection within 30 days of surgery, catheter-associated urinary tract infection, and hand hygiene statistics. Then post-operative venous thromboembolism indicators include serious blood clots after surgery, post-operative venous thromboembolism following hip and knee surgery, and we have also seen mortality following venous thromboembolism in our mortality indicators. Then harm. These include safety incidents involving severe harm or death, problems in healthcare involving severe harm or death, incidents of medication error causing serious harm. Medication errors include wrong medication, wrong patient, wrong dosage. Then safety of maternity services. The indicators include the admission of full-term babies with neonatal care, rate of instrumental vaginal birth, obstetric trauma rate with or without instrument. Then false related indicators, proportion of hip fracture patients with plan for future fall prevention have been highlighted as important indicator. Percentage of older patients assessed for the risk of falling is also an important indicator. Hip fractures from falls during hospital care. Then pressure ulcers, the rate of severe pressure score, source, proportion of patients with category 2, 3, 4 pressure ulcers. Then other safety indicators include unplanned transfer to any critical unit or cardiac or respiratory arrest, bleeding requiring transfusion or exploration. Then patient-centeredness or indicators related to patient experience. These include maternity care, in-hospital personal needs, outpatient and emergency care, and others measures. So these are the headings under which I'll describe the indicators for patient-centeredness. For maternity care, we can measure women's experience of maternity services. We can measure rate of term babies with Apgar score less than 7 at 5 minutes per 100 births, rate of deliveries at 40 weeks gestation or beyond with IUGR, gestational standardized perinatal mortality rate. Then in inpatient personal needs, the patient-centered indicators include responsiveness to inpatient personal needs, percentage of patients reporting a positive experience, courtesy score for staff, quality of meals, quality of physician care, quality of nursing care, housekeeping score, admission process score, inpatient satisfaction rate, discharge with personal satisfaction. Outpatient emergency care include outpatient satisfaction rate, and emergency department services include measurement of patient experience of emergency services. Other measures of patient-centeredness include the facilities for families and visitors. We can take their feedback. Patient satisfaction percentage, rate of patient complaints, other stakeholder satisfaction, social satisfaction, waiting time, percentage of patients informed, and patient's perception. Then financial indicators, I'll talk about under following headings: general financial indicators, hospital performance, payers performance, physician performance, reference to outside center, and expense incurred by hospitals. So general financial indicators include administrative service expenses as a percentage of total expense, cost per weighted case, year to date funded, and cost per weighted activity unit, healthcare expenditure per capita by potential years of life lost, cost of hospitalization and emergency department visit, that is average cost of emergency department visit by admission status, recurrent cost per hospitalization and per maternity separation, hospital and health service full year forecast operating position, ratio of total revenue to total costs, percentage deductions of hospital, average hospitalization expenditure, average outpatient expenditure, average expenditure per bed per day, current cost per bed, ratio of current expenditure to current cost, the cost of drugs and material, percentage personnel cost to total cost, total fixed cost for per bed occupancy, budget flow compared to approved budget, emergency service expenses, personnel expenses, goods and service expenses, medicine expenses, average cost per day of hospitalization, the legal complaint from a hospital. Financial indicators for hospital performance include revenue generated, profit margin of the hospital, clinical cost, reimbursement, then AR aging days. These are accounts receivable aging days, accounts which are received within 35 days, from 35 to 50 days and more than 50 days. And if it is more than 50 days, it is not a good sign. Then payers performance, that is percentage of claims paid, claims denial rate, reimbursement amount, value. These are related to insurance. Then physician performance, that is revenue per physician, reimbursement per physician. Referral to outside centers include ambulance diversions, physician non-availability. Then expenses incurred by hospitals, overtime hours, test result errors. Then human resource indicators. These include staff satisfaction rate, staff turnover, training expenditure per capita, average hours of internet use, the amount of electronic media record, number of days of sick leave to total employees ratio, employees absenteeism rate, rate of employees sick leave, rate of absenteeism, rate of resignation, transfer, average payment, number of specializations, courses, personnel perception, staff to patient ratio. Then social accountability and reactivity indicators. These include percentage of consult patients, percentage of patients with general practitioner or specialist referral, percentage of patients recommended for discharge, percentage of patients transferred to other health units, and childhood immunization rate. Then finally, documentation compliance indicators. These include number of deficient records less than 30 days, number of delinquent record more than 30 days. So this was the extensive list of indicators, and most of them are key performance indicators for hospital management. Thank you very much.